cloud. And then I'm going to try to get the live. We never really know what's going to happen.
That way my desk looks clear.
Mine always looks clear these days. It's hilarious. So it says that it's streaming on Facebook, and yet my other screen says that it's not. So we are live on Facebook now, which is awesome. Hello, everyone. This is Dr. Jennifer Gardella. We are here for our bi-weekly, although I think we skipped 2 weeks ago. Oh, I have to click the OK button, that I'm okay with live streaming this. So we skipped 2 weeks ago. Sorry about that. But I am here with the good folks at BCHIP. Today, we have the good honor of being with Colleen Campbell, who works on the team, is part of the team with Kim Everett. Colleen, why don't you start us off and tell us what you do there for BCHIP?
Jen, we're so excited to talk to you today specifically about this topic, but my name is Colleen Campbell, and I am the long-term care manager. I wear a dual hat. I run our advanced care planning program for the community, and I am also blessed to meet with and bring 31 of our skilled nursing facilities to the table to have input, say, guidance in best practices for long-term care patients in Bucks County skilled nursing facilities.
Yeah, so let's talk about some of the things that are going on this month for the area, I should say, of advanced care planning. So before we get into what it is, why don't you talk a little bit about what's special about this month and why Kim booked this call a month ago and said Colleen's coming on.
A month ago, yes. Well, we're very excited because every year there's multiple days throughout the year. It's designated for healthcare, teachers, whatever, but yes, multiple. So we're excited because this is the first year since COVID interrupted our normal flow that allows us to get education and awareness out to the general public about National Healthcare Decision Day. And that is April 16th every year. It's the day after taxes on purpose because, as Ben Franklin said, there are two things guaranteed in life: death and taxes. So we allow you to get your taxes in, and then you're going to see a lot of ads on TV, a lot of print ads, social media, mainly also from us here at BCHIP, about really making people aware of advanced care planning and why it is so important.
So, okay, fantastic. So we're celebrating that this month. Why don't you go ahead and tell us why it's so important?
Well, advanced care planning is so important because we realize that most people, in making an advanced care planning document, it's been perceived to be the document for older people and as the quote unquote document for when I'm dying. And that's not really the case. We are finding that, and all you have to do is turn on your news, people that didn't anticipate something to happen to them on the way to and from school or work, a catastrophic illness, perhaps of a sudden heart attack or stroke, head injury, and we're finding that more often those people are not in a demographic category of the elderly. And we wanted to be able to promote the program, or, as we call it, our advanced care planning program for all ages, anyone over 18 and above. And the statistics that we have for Pennsylvania from the PA Medical Society, 20% of Pennsylvanians, only 20% have an advance directive. 90% say that it's a very important document, we must have it, but only 27% have actually done it. So a lot of times when we get our referrals from our physicians and our hospital partners, a lot of the times, well, what made you call today? How can I help you? And they said, my doctor wants me to do it. Okay. And then we have a lovely conversation and we explain to them, did the doctor say why you needed to do it? And they go, no, it's just important and I need to get it done. Okay. So I want to take a moment and tell you why it is so important, because our program and our facilitators are mainly volunteer. They have gone through Respecting Choices, which is a national model of training. I am a trainer as well as a facilitator to host the conversations. And we spend the day learning about really being the facilitator in that conversation, asking people. I mean, most people automatically assume, and by the way, our advanced directive, what I'm referring to today, is on our website at bchip.org. You can go to the advanced directive page and see the document that I'm referring to. So the first part of our document is anywhere in Bucks County. Now, we do have physicians that and hospitals that border other counties. We will also honor that if a Bucks County physician or hospital is their first choice. But what we're doing is if I'm permanently unconscious or have an end stage medical condition, I ask that my agent, family, and care providers to honor my wishes as indicated in this document. So most importantly, this only comes into play if you cannot speak for yourself.
Right.
If you're at the hospital and you can speak, then you say, I want that exploratory surgery. I want that procedure. I want those things. Or, you know, your medical condition, we're going to try this treatment. But if you can't speak for yourself, the biggest decision mainly is, what do I want medically? Do I want to receive all life-sustaining care, including medical and surgical treatment to keep me alive as long as possible, even if it prolongs my death? Or do you not want life-sustaining treatment and want a natural death to occur from whatever brought you to this current position or state of unconsciousness? So the treatments that you would not want would be CPR, a ventilator, things like that. So that's the biggest question. And sometimes it's the last question we answer with our document, I have to tell you, because we really want people to understand by documenting their wishes, it allows their family to honor their wishes. And if you're a control freak like I am, you do want, yes, right there, you do want to say into what you do and do not want. We've had people simply say, okay, the next step is organ donation. I either want to donate my organs or I don't want to donate my organs. And then we ask them, what is an acceptable quality of life to you?
Yeah.
Not necessarily, I never want to go to a nursing home. I never want to go to a nursing home and be a vegetable or be unaware of my surroundings to know who I am and who I'm with. So we ask them if it's okay for your family to say, I'm going to go there for rehabilitation, be it speech or physical or occupational therapy. And then the next thing that I generally start with is, what brings you comfort when you are sick? What brings you peace of mind?
Sure.
Now you giggle and I say, some people go, I'm unconscious. I'm not saying I don't need anything.
Right.
And then I've had people write a dissertation, literally, that they want their face washed, their hair brushed, good oral care. I had a nun in her 90s who literally wrote on a gauze square, she wanted a good vodka and listed 3 types to be rubbed on her lips. And as she put it in her own words, in her own writing, when I arrive in heaven, I want it to be as if I left a party. So it was something she thought about, and that meant something to her. Some people prefer to be read to or have music played. Some people would like to die at home. Well, if medically possible, we try to get that from them. What is it that you want at home? We've had people adamantly say they want no family to be contacted until they are pronounced dead, because they are, how did they phrase it? They are all drama. And I don't want that at the end of my life. I want calm and peace. So you're laughing, but these are actual conversations. And then most importantly, what we allow them to do, or our document allows them to do, is name a healthcare agent, someone that will speak for them, that will honor their wishes as they have them written. And our document allows you to have 3 spaces. If you had 4, we make exception, but ultimately, so that if the first person is not available, they go to the second person and the third person. So when I say to people, sometimes, well, I only need my husband or my wife. And I say, what if you're in the same accident? Then who
Right.
do we contact?
Sure.
And then we go through and review the powers of a healthcare agent. For clarity, a healthcare agent does not have anything to do with money or financial matters. They have everything to do with honoring the wishes as you've written them, to end or extend life support, to admit or discharge from a medical facility, and to allow a physician to allow natural death to occur in a facility. One of the
And
things
they,
that go ahead.
I will say this, they actually have to follow what you wrote. So they, the hospital, you just don't walk in, your healthcare agent just doesn't walk in and say, pull the plug.
Right, exactly.
Hospitals don't
Oh,
allow
I'm not,
that.
I'm mad at her. I haven't spoken to her for 3 months. I'm not doing what she
But on
wants.
the healthcare agent, pull the plug. You actually have to show the document, which is why a lot of the times, and I know your process goes through this, a bunch of people, including your doctor and your local hospital, should have a copy of this document. If you're going in for surgery, make sure that a copy of the document goes with you.
And that's a valid question because a lot of times when you go to the hospital, either for routine testing, surgery, or through the emergency room, one of the questions you're always asked is, do you have an advance directive,
Right?
otherwise known as a living will?
No.
Do you have this document? And most people go, oh no, or I meant to, or I have it. And then, well, okay, where is it? So due to that importance of if you have the document when it's needed at your fingertips, then it makes it easier. So I just did our data for this fiscal year, and part of our program was to not only complete the documents, but to have them readily available, as you said, at the hospital with your physician, with your specialist. Even sometimes we've mailed up
Oh,
to 11 for
yep.
specialists, specialty doctors, and then your healthcare agent or your family. So if they're not the same, then they have them. We are able to now accept an electronic copy of your
Scan it
advance
into
directive.
Drive. Yep.
You know exactly. You no longer need an original document. Obviously, the one that was witnessed, we make copies of for you. But what we're starting to do now is ask the client or the physician's patient that they refer to us, would you like a PDF? Would you like an electronic copy?
Brilliant.
So then everybody has it right there. But here's the best part. Because our document allows a HIPAA authorization for them to discuss with you the medical condition, we also have a healthcare agent contact sheet, which not only lists your healthcare agent, their address, their phone number, their email for everyone that you've documented.
Great.
Why is that so important? Because if we can't get into your phone, we have no idea. So BTIP, of course, goes one step further and gives you a wallet card to put with your license or your health insurance cards or on the refrigerator that says, I have an advance directive as of this date. This is my name, my address. This is where it's located, at which hospital, which physician.
Mm-hmm.
You turn it over. My healthcare agents in the event of an emergency are name, phone number, and then my family doctor. And also my family doctor has a copy. So even if you're traveling, they can always, with your family doctor's phone number, they can always call and say, hey, could you send this to the hospital or the healthcare agent? I can
Great.
reach them and say, they've put me in charge. I have this information and this is what they do and do not want.
Beautiful. I
So
want to go
we're
back
very
to
excited.
yeah,
Huh?
you're very passionate about your work. This is what I
Uh,
love at BChip. You all are like, we are going to help people.
and
Beautiful.
it's as a retired paramedic of 31 years, as you know, I've seen the need for this document multiple times.
Right.
And I've seen families destroyed over, nope, I can't, I'm not ready to let them go, versus they wouldn't want to live like this. And that's our big caveat. If I can't wake up and know who I am and who I'm with, then please don't prolong my life.
Right.
And that's it. So and some people write that I want all of my healthcare agents to be involved in the final decision. because they don't want to upset someone. But, as we were talking offline, I have some family members that would easily charge their phone with the plug to my ventilator.
I think I have one of those.
Yeah. So, I mean,
She's so
and I,
annoying. Unplug her.
yeah, and I make light of it only because all of our facilitators are just as passionate as I am in pulling that information from them, saying, okay, who can speak for you? What do we want? What do you want them to know? And some people have even gone to the next step is with their advanced directive and living will and their will, which is for personal belongings and money and finances. They've written letters to their families.
Mm-hmm.
And so what I like the most is, unless someone has requested us to, this document is in their hand. It's penned with their handwriting. And having lost my father,
Mm-hmm.
his handwriting means the most to me.
Sure.
And that's 16 years later.
Right.
So to recognize that, or to feel that and say, or in this day of technology, we invite the family to be part of the conversation. If they can't come personally, they can come electronically through Zoom or
Sure.
Teams and be part of the conversation and hear what needs to happen. We don't pressure anybody into signing the document. If they're not ready, they're not ready. It's okay. We'll reschedule. You'll come back. You'll ask your questions. And I just think it's so important, because sudden death or sudden catastrophic illness or injury is can be prepared for. Okay. And we are prepared in some of our, first aid kits or emergency preparedness and things of that nature. But when you can't speak, to have somebody called and the right person called. And for me, if there's no chance that I'm going to live, please do not put me through
Right.
that tearful goodbye. It's going to be hard enough as it is for people to lose someone so suddenly. There's anger, there's guilt, there's fear. But if you can say, but I did what they wanted, we all did what they wanted.
There's a
There's
lot
no
of
name
power in that.
game.
Yeah.
There's no name shame. There's no, well, you wanted to keep her alive because you want the house, or,
Right.
most people don't do that, but for the most part. So the difference between a will and a living will, as you know, is the will is all money and property belongings.
And that
This
should be done in consult with an actual attorney
with an
to make
actual attorney.
sure that everything is lined up. I just want to say that part too.
Correct. Thank you. I appreciate that. But the living will is generally done when people are healthy, or they've had a moderate medical diagnosis
Mm-hmm.
that doesn't say they're going to, need like a cancer diagnosis and treatment and all that stuff. This is right here where you are now. If something
Right.
changes a week from now, a month from now, 5 years from now, you can update this document.
Sure.
And we encourage people to look at it regularly, because if you looked at a document that you completed many years ago, they're check boxes. I want a ventilator, but I don't want a breathing tube. I want a feeding tube, but I don't want this. I want meds, but I don't want an IV. And it's contradictory. Not to mention, who was your named healthcare agent at the time? Are they
Right.
still available?
Like
Are
your
they still
ex-husband or
able to
somebody.
perform these duties?
Right.
And is their information correct?
Right.
Many times in the hospital, we'd have an advanced directive from EMS, and it would contain, this is my son's number, this is my daughter's number, but it was done 15, 17 years ago, and they have jobs and they now have cell phones. So the only number on the document was a home phone. So you're leaving a voicemail message saying, we have your mom in the emergency room and she suffered a
Sure.
catastrophic heart attack.
Sure.
We need someone to call us. We need to be able to do, in light of what needs to happen. Wow. And I can tell you that
You are on fire. So
I
let's
am,
talk.
because I love this month. I love this topic because I think people just don't understand the importance of preparation.
And I'm going to stop you there and say something that you and I have talked about, something Kim and I have talked about. This is not just for old people.
Correct.
So I learned about these documents and their importance, obviously, years ago for me. But when my daughter was transferring to the University of Westchester here in Pennsylvania, I met a mom at parent orientation for the transfer students. And the reason why her son was transferring from like Tennessee to Westchester is because the previous semester, I think it was Tennessee, could have been Alabama. Anyway, the reason why he was transferring is because he had gone into the hospital down in wherever he in the South and did not have one of these documents on file with the university. And if your child and was not, I think his appendix had burst, something terrible had happened, and he was not able to make decisions. The hospital then does not have the responsibility or the legal ability to release any information, even if you are the parent paying the tuition bill, you are the parent paying the health insurance, or you are the parent providing the health insurance. You have no legal responsibility to take care of your child. And the family felt that their son had gone too far away. But from that experience, I learned that what you can do, and again, this does not cost you any money. That's the beauty of the program, is that you can fill out these forms with your kids, make these and have these conversations, let them know what your plans are, have them decide here, obviously it's probably going to be mom and dad if they're away at college, but then scan these things into Google Drive and have them accessible. We have an ID file in Google Drive of all of this stuff because we're all over the place now. But it's so important that everybody has. So if one kid goes into, who was in law school, goes into the hospital, I have her documents here. So I have power of attorney, or, I'm the healthcare agent on all of them. They'll probably switch those very soon. But it is so important to do that, because just like everyone thinks, oh, a will is so important, or the financial power of attorney is so important. Actually, and those things are very, very important, but those are a lot easier also to get control over legally when you need eventually.
Correct.
With the healthcare stuff, that you could be in a split decision, and the hospital is not going to allow you to make decisions unless you have these documents.
And extend it even further to a parent versus a child away at school. What if you're engaged?
Oh yeah, then they have
you don't name anybody and you don't have this document. The law in Pennsylvania says it's your parents, your siblings in chronological order, your grandparents, aunts and uncles, close family friends. There's a whole law. I could quote it to you, but that's not what today's about. But if it is you want your fiance to know that, or it is a same-sex partnership, you need to be able to have that document done as well. And a lot of times, yes, we will think different at 18 and 20 that we will in our 30s, than we will in our 50s, that we will as we age. That's why, again, our document is a living will, because as you live, as you age, as things change, so does your perspective, and the form can be updated at any time.
Right, absolutely. And that's so important. And also, if a doctor, the one thing that I've always stressed in anything that I'm dealing with, you want the doctor and the nursing staff focused on the patient. You don't want them trying to get in touch with you. That should be a super easy part of the
exactly process. And when you look at our document, that's the first thing. Even though I said sometimes we come back to that as the last decision made, that is the first thing that they need to know when you come in a state of unconsciousness. What do they want? What's happening? And I don't say a state of unconsciousness that it's a diabetic emergency and we can fix that, or an infection and we can fix that. If you are in need of life support, where do they go? And that's why it's the first section of our advanced directive. And you can get advanced directives free online. I'm not saying anything's, but our trained facilitators counsel you through the completion of the document. And then, of course, it's only good if it's where it needs to be when it's needed.
Right. So let's talk about that counseling, because one thing we've also talked a lot about is I always bring up the episode of This Is Us, which is now off the air, but Mandy
Mhm.
Moore's character knew that she was dealing with advanced Alzheimer's, and she sat her kids down, one of whom was an attorney, and she said to them, my new husband, well, I don't think he was new at that point, but not their dad. Their dad had passed away, but he was going to be the one making decisions until he could no longer. And then she actually said to her kids, here's the pecking order of who gets to make the decisions.
And it wasn't the birth order.
It wasn't birth order. Well, they were three
Well,
twins,
they're,
right?
yeah, sorry,
So it
twins and then a
wasn't,
third adopted. Yep, you're
that's a
right.
really
You're
good
right.
point, though. Wait, we'll get back to
Yeah.
that point. That's a really good one. But what was
Mhm.
interesting is that it wasn't the attorney. It was
Mhm.
her daughter who, for when you said it beautifully, you want to find that person that aligns with and is going to truly respect what you want to do. And one of the beauties of the program that BCHIP runs is that, as Colleen has said, they are trained facilitators who are there to guide your family through those decisions. And the big distinction is this: you're not dealing with who gets the house or who gets the money. So the love, and it's a much more serious decision, because you've got to make sure that the right person is going to turn on the ventilator or put one on. And so
And
that's
honor your wishes.
right. Honor your wishes. So what's so funny also is that this day that we're talking about here, Healthcare Decisions Day, is on my daughter's birthday. And she is the one
Uh-oh.
who makes the decisions, because I know she'll keep me alive as long as possible. And
Yes.
she's the oldest, but that's a very important part of your work, is helping an individual and then a family understand who has been selected.
Right. And there's a lot, people have called us and seen our ads or whatever and said this must be a scam, how could it be for free? And we are very grateful. We currently have grant funding to support our work in this area. Thanks to the Bucks County Commissioners, we work alongside of our health systems and our physicians to make sure that this information is not, again, completed correctly, understood, and where it needs to be. So we're,
Speaking of those commissioners, you guys are getting something exciting is happening for
oh
Beach.
my goodness, I completely forgot to tell you the very best part.
I keep notes.
Because of it being, thank you so much. You're the best, Jen. Because of our work and it being a national recognition, BCHIP will be receiving a proclamation this Wednesday, April 3rd at 10:30 a.m. at the commissioners meeting. And we're really excited because it allows us to, again, promote
Right.
long-term care planning and advanced care planning and saying, this is, please give us the opportunity. We are partnered with um, St. Luke's, Grandview, Doylestown, St. Mary, Lower Bucks, and Jefferson Bucks, i.e. also Jefferson Abington. So all of these physicians have the ability to refer to us, where
Sure.
we then can get those documents. Somebody, if they're going to Capital Health, we get the document in Capital Health. Penn, Fox Chase, we're diligent about making sure that document, and if it can't be placed, I had a family that vacations in Florida, and one of the spouses had been a patient there at this hospital and one had not, and they would only put the one who had been there in. So I called them back and said, just take an extra copy with you when you go on vacation, because in case you need it, you have it with you, but I can't put it
Right.
in the hospital.
Brilliant.
So.
Well, any closing remarks, thoughts?
Two things certain in life, death and taxes. So, contact BCHIP. We'll help you with the document. And and again, there's no pressure from us to have it completed the first time we meet. Talk to me, ask me your questions. And if it's not the right time for you to make the document, then we'll wait for you.
And this is all about healthcare decisions, which are left in your hands, right? That's the kicker.
Correct. Correct.
That's what we
Yep.
want to. You have the right to make decisions for you and your family. So
Correct. Correct.
awesome. Well, it's
So,
been lovely as always. Thank you so
oh, well,
much.
thank you so much. I
You could have done
appreciate
this
that.
video without me, I think. You were
No, no, no. Oh my gosh, you asked the greatest questions and I knew what we were going to say. Again, bchip.org. And it really will give you some additional information about our program, and you can actually see what the forms look like.
Yeah, and I'll link to the page on the BCHIP site after this is posted on the Facebook page. It's live right now, but we'll put that in the comments so people can make their appointments. And then you get to spend some time with Colleen, who's lovely.
Or our facilitators, they're all fabulous. So
okay, great. Well, I'm
okay.
going to click off the live, and you guys, if you want to rewatch this, if you still have questions, you can do that or call into the office. Thank you, Colleen.
Thank you. Take care.